you can draw this diagram which shows the kidney, the adrenal. The second layer is the perinephric fat. This perinephric fat is lying between the renal capsule as well as the Girota's fascia. The third layer is the renal fascia, which is also called as the Girota's fascia. This Girota's fascia is made up of two layers. The anterior layer is also called as the fascia of Girota, whereas the posterior layer is called as the Zucker-Candle's fascia, which has been asked many a times in your MCQ. These two fascias on the lateral side fused to form a single fascia. Later it blends with that of the parietal peritoneum. The importance of the Girota's fascia is that it lines the major blood vessels as well as it also lines the ureter. And the clinical importance of this Girota's fascia is that as it lines the ureter, it is having some clinical importance as if there occurs injury to this kidney, the blood from the ruptured kidney or pus from any perinephric abscess goes along this fascia into the pelvis. The last layer was the paranephric fat. This layer lies in between the renal fascia as well as the anterior layer of thoracolumbar fascia. The internal structure of the kidney can be divided under two major headings, that is the macroscopic and microscopic. The macroscopic, here we are going to study about the macroscopic features, whereas microscopic we are going to study under histology. If we take a coronal section of the kidney to study the interior of it, we can see the kidney has been divided into two major parts, that is the cortex, which is reddish brown in color, as well as the medulla, which is on the inner aspect and which is much paler in color. The cortex, which is darker in color, is again divided into two parts. That is, the one which is covering the pyramids is called as the cortical arches, because they are in the form of the arches, so that's why called as the cortical arches. And the one which is dipping inside this are called as the renal columns. So these are the renal columns and these are the renal arches. Whereas the medulla is formed by means of 8 to 10 renal pyramids. The apex of the pyramids is towards the hilum and the bases are towards the cortex. The medulla contains the renal pyramids which are striated in appearance. We can see the striations of this, and the apex, it goes and drains into the minor calyces. From minor calyces the urine goes into the major calyx, and from the major calyx to the pelvis, and from there into the ureter. So the apex of the renal papilla, they are going to form, the apex of the renal pyramid is going to form the renal papilla. So these are the renal papilla. Whereas the space which is here is called as this renal sinus, into which the major blood vessels are present. That is the renal artery as well as the renal vein. So this is also one of the nice diagram showing you the internal structure of the kidney, in which this is the outer cortex is there, inner is the medulla is there, medulla which consists of the pyramids which are having the bases towards the cortex, and the apex, which is called as the renal papilla, from where it goes and drains into the minor calyx, from minor calyx into the major calyces, and from there to the renal pelvis and the ureter. The blood supply of the kidney. Firstly, the arterial supply. The arterial supply is by means of the renal arteries, which are the branches coming from the abdominal aorta. The right artery is longer than the left one because abdominal aorta lies on the left side of the vertebral column. First, this renal artery divides into the anterior division and the posterior division. Then it goes and supplies the various segments. So there are the 4 segmental arteries which are given on the anterior side. So here you can see these are the apical, upper, middle and the lower segmental arteries. From the segmental arteries, it gives the lobar arteries. Lobar arteries, it goes and supplies the lobe, and then it gives the interlobar artery between the 2 lobes, that is the interlobar artery. Then it forms an arc here. This artery is called as the arcuate artery, and from the arcuate artery, this artery which is going between the various lobules is called as the interlobular arteries, and this finally ends into the end arteries. So we have seen this from the abdominal aorta, the renal arteries, then goes the segmental arteries, then the interlobar arteries, then arc forming artery, that was the arcuate arteries, then interlobular arteries, and from there it forms the capillaries, and which are then the end arteries. Similarly, the venous drainage will be in the reverse direction from interlobular vein to the arcuate vein to the interlobar vein to the segmental vein, then the renal veins, and from the renal veins it goes and drains into the inferior vena cava. The connection between the arterial supply and the venous drainage is, after the interlobular artery, it divides to form the afferent arteriole, then goes into the glomerulus, then comes out from there as the efferent arteriole, and then from there to the peritubular plexus, from there into the interlobular veins. So this is a very nice diagram which is showing the interlobular artery which is forming the arcuate artery. From the arcuate artery, this was the interlobular artery. From the interlobular artery, we have seen that is the afferent arteriole which is going into the glomerulus. Next comes the nerve supply of the kidney. The nerve supply is coming from the renal plexus, which is apart from coming from the celiac plexus, and it contains the sympathetic nerves coming from T10 segment to L1 segment, which are chiefly vasomotor. The afferent nerves of the kidney belong to the segment T10 to T12. This autonomic plexus helps in vasodilation or vasoconstriction of the renal arterioles. The lymphatic drains from the kidney into the lateral aortic lymph nodes, which are following the course of the blood vessels. Applied anatomy of the kidneys. There can be some congenital anomalies of the kidneys which can be seen, that is unilateral or bilateral agenesis of the kidneys can be seen, in which kidney can be absent on one side or it can be absent on both the sides. There can be even the multiple kidneys which are seen, or there can be the horseshoe shaped kidney. In horseshoe shaped kidney, the lower poles of both the kidneys are united by means of an isthmus. The horseshoe-shaped kidney is usually at the lower level because it cannot ascend upwards because of this inferior mesenteric artery. Next condition is the congenital polycystic kidney. In this condition, the secretory and collecting tubules fail to negotiate and the kidney is riddled with numerous cysts. Here you can see various cysts. So that's why it is called as polycystic kidney. The next congenital anomaly can be the ectopic kidneys, in which the kidney is not in its normal position. It is lying in the pelvic region. So that's why this kidney is also called as the pelvic kidney. This is the image which are showing the two kidneys of this. The left kidney you can see it is lower down, and this condition is called as the floating kidney, in which the kidney can be moved in upward and downward direction but it cannot be moved side to side. This is the renal angle. In this diagram you can see this renal angle is formed by means of the lower border of the 12th rib and the lateral border of erector spinae muscle. The importance of this is that whenever someone is having any problem with the kidneys, there is a tenderness at this renal angle. Renal colic pain usually shoots downwards and laterally from this region to the groin region. A normal kidney of an average built individual is usually not palpable, but in thin subject, lower part of the kidney can be made palpable during deep inspiration by placing two hands, one in the loin region and the other in the anterior abdominal wall as shown in the diagram. And by exerting a gentle pressure, we can palpate the lower pole of the kidney. And this examination is called as a bimanual examination of the kidney. The renal stones, this is a very common condition in which the stones are seen in the pelvic region, pelvis. The condition in which renal stones are seen, in that condition, we are doing a procedure called as lithotripsy, in which the stone is crushed and then the stone can be normally come out from the ureter. There can be infections of the kidney around the kidney, that is called as the perinephric abscess. Here you can see this black color marking as the perinephric abscess site, and which is limited by means of this renal fascia, but it can extend downwards till the pelvis. Most of the time, the kidneys have been resected from the posterior aspect, and one should always remember that the 12th rib, for removing of the or doing the surgeries of the kidneys, one has to remove this 12th rib, and it is always in relation with the pleural cavity. So while removing the 12th rib, one should always remember that there can be a danger of removing of or opening of the pleural cavity. If we expose the kidney from behind, the various structures which are cut are the skin, the superficial fascia, the posterior layer of the thoracolumbar fascia, which is containing the latissimus dorsi and serratus posterior inferior muscle. Then comes the erector spinae muscle, then the middle layer of the thoracolumbar fascia, then the quadratus lumborum, and anterior layer of the thoracolumbar fascia. So these are the various layers which are cut. Thank you for patiently listening to this session.